Yeah.
it's not too difficult, but it's hard to describe.
Okay.
Um, the upper part of our forehead is
Mm.
get signal from two parts of the brain, the left and the right. So
Mm.
if we have damage in the left side, we still
Mm.
have the right side signal to control it.
Correct. Yes.
But if we have the damage in the left side, we can see the blue line from the left. It will affect it to the lower part of our face, so it
Yes.
will don't have signal from it.
Yes.
So it's get fuzzy.
Yes. Correct. And that's it for this case too. This case, that's the get damage from the left side. And you see when they describe about the on MRI and some lesion, injury, any problem, the left side. But then the right side get the positive. Like for this patient, the face have that's the loss function of the face. The lower part of the face is the right side, and the left side, the brain get affected like this case. So with the loss that and the upper part still preserve, mean like still like spare, still intact, not diminished. So if they get that's it mean like central. It may happen in brain. So it is not in central, in peripheral. So what happened? Where's the peripheral? Is here from here. I mean damage from this place. So from the peripheral, you can see they cut the signal from the we call purple light and the signal from blue light, and then this patient loss of two function from the upper and the lower part for the face. This means like peripheral positive, I mean CN positive, 7 positive, and the patient cannot wrinkle forehead. And that's usually the ipsilateral. For the central, usually this is contralateral. Yeah, good job. So when talk about upper, this is the lower, and some the cause from the upper is usually from stroke, hemorrhage, tumor. But for the lower, usually like affect to the CNS, like especially for the ear, for the any patient acute left side infectious endocarditis. However, blood culture confirms staff who is usually called the right side infectious endocarditis. It didn't story why like with the staphylococcus go with the right side infectious endocarditis. So for the endocarditis divide left and right side. Okay, so why that for this case you think? Do you think like the patient acute left side infectious endocarditis? Yeah, quite have the question for us. So the patient have acute left side infectious endocarditis. The blood culture confirmed that staphylococcus aureus. That's usually called the right side. I don't think like that's have any conflict here. This is staphylococcus aureus. They go with the blood stream, right? They can bump to the lung. Okay, they then bump to the lung, and then they can get along again about to the left heart. So I don't think they have any conflict in here. They can go with the right side, and then they get through to the left based on the respiratory circulation, and they go back to the left heart with the mitral, because they affect to the mitral valve. It's not like about the bicuspid valve. You go with the bicuspid valve, maybe that's go with the right side. But the mitral valve, that's most common valve, can get effect from the that's a mitral valve. Yeah, that's a bacterial, especially for the endocarditis. All right, so two of you guys leave. Yeah. So another about the visual defect, field defect. So in this case, I will go with the case. I will not explain all of this. They have the homonymous hemianopia, like this case, like this picture. So okay. So okay, I will, if I go with explain the whole thing, you guys need maybe 30 minutes to understand the whole everything here. That's to be honest. So let's go with the half of the brain. I mean the visual vision visual field. That's a hormone is mean the same, and this hemianopia is mean like this is half of this. So that's that like that's usually from like the optic tract. So you can see here the optic tract is mean like from that place. They can go to they have the crossover. It's mean like the place here they get crossover, and that's you see this the previous picture like they have about a positive for the CNS7 kind of like that. So when you see like the visual field, they can receive two signal from the right side like that. They have one line, and they have also supply for another half of the eyes. Same with the right side too. So any effect to here like that. Any effect to that play from like we call like optic tract go with that tract is mean like the line. Any damage in here, if they go with like have problem in here. Okay, so what happened with the eyes of the patient? You can see they lost the blue the green one, the green color lost, and they can see from because they have the signal from the right side, and they have a half of the eye. You can see that it's mean like homonymous hemianopia. You guys can get that. And if it can be different if you get the damage in the chasm, optic chasm, or even like go with another place like inferior, like it's some that we call like some what the name for that? They say this is a radiation, but kind of like have some the lobia here. Lopiers mean like the brain region can have damage from like here or here. They can another different about the visual defect. Okay, and Leon can explain it here. Yeah, travel the left side. Investigation have the ASD. Let's go with ASD. They can bump from like direct from the right to the left. But why they cannot go with the respiratory circulation and they go back to the right, the left? They can go with that way. I understand they can bump direct from the right to the left like that, but if a patient like that, they need to have the ASD. Okay, so we also have about the macular spare. About macular spare, this usually belongs to the occipital cortex, and macular spare means like still have the cycle, half a cycle here, and still keep intact. And this not diminish. It means like this still can see still here. That we call macular spare. That usually from the occipital cortex. So why this happen? I can explain if you study the neurology. That's usually because they have still have the small branch of the posterior brain vessel. That's usually for this supply for the occipital cortex, and they also have another brain to supply for the not hemino. It's not like hemi. It's not temporal. That's not like about this occipital, another lobes. Can you guys help me? If it's not, it's okay. Don't worry. Like the reason why they still have the macular spare here. Some kind of the cause like about this eye pathology, optic neuropathy, or some kind of sudden with the vascular, like this case, or the acute in here like infection or inflammatory demyelinating, subacute like neoplasm or chronic degenerative posterior cortical atrophy. That's kind of the cause. We can base on that to choose about the cause. I mean the diagnosis. Just that. Do you have any question for me? Oh my god, you guys. Everyone go all this. Okay. Lots of people left. Any question for me? Like, let me stop. I don't know why I cannot. Alright, anyone can have a question for that. You understand that, okay?
I don't want to say this, but sometimes, patients tell that they don't use drugs, but you never know until you do a urine drug screen.
Good point.
I say that it's not like you doubt your patient and what they're saying, but he's 20 something years old, so You never know. One thing that you guys should also think about is, what if the blood culture doesn't reveal anything? So you have to think about meningococcus as well. He may have a co-infection with meningococcus because he's sexually active age. So make sure you think about that as well. Just some side notes. Because we have a blood culture, everything is easy. But what if we don't have a blood culture? Because blood culture usually will take like 1 or 2 weeks to come back, or a few days at least. But always treat first before you think about what caused it. Otherwise, your patient will die.
It kills me.
Yep.
Yeah. I would like to ask more about the antibiotics in this patient. I mean, the blood culture take take time to do, right?
Yeah,
So
right.
at long, so for the first time, for the very first day, the patient is hospitalized. Which antibiotics should we use in this patient? I mean, we just know he got encephalitis, and so I wonder how we could use antibiotics
So you asked about like what we can do. Like the antibiotic we should use for this patient, right?
Yes.
So they have
like the treatment plan.
Alright, so I want to ask you guys about. I forgot to ask you guys about the differential diagnosis, because this case have lots of things to talk to share. But about I will ask you about the treatment plan. So what you will do for this case? Based on the now they have the result of diagnosis. The patient have the bacterial endocarditis, embolism, and make it encephalitis. So what you will treat for the patient? Hate to use kind of.
I think we should use antibiotics. But beside that, we also have to take care for the skin.
You also what test for what? Sorry.
Besides, we use antibiotic medicine. We also have to take care of the skin, like antibacterial steps to it helps we take a lower risk of developing the skin infection.
So you want to start with antibiotics first, and what is talk? I don't understand.
I want to talk about the bacteria first. So I think we should use medicine for it, and we will use antibiotics.
You say that we will we will figure out what is a bacterial, and then we will choose exactly my antibiotic, right? That's what you mean?
Let me think.
Okay, so
yeah.
So
I think because we get infection in here, so we will use antibiotics to preventing the endocarditis. Yeah, but I mean, I don't really know what kind of antibiotics that we use, so I will focus to take care of the skin first to make lower risk of developing the skin infection. So it's a kind of prevention. So
okay, so in summarize, you will choose the patient antibiotics, and you will go this before you make the diagnosis, right? I hope I understand well Anyone have another understanding? I feel like I'm still confused.
Yes. So the diagnosis is endocarditis, right?
Yep.
Yeah. So you asked about the
Treatment plan.
the treatment.
Yep.
So yeah, treatment plan. So I think we should have antibiotics plan first
Yep.
to treat this disease. And beside that, I think we should take care of the skin. We use antibacterial stuff like to clean the skin for prevent from infection.
So you want to do another stuff to prevent infection in where? Breast infection in the valve, or infection for the blood vessel, or blood or bloodstream, or infection in another place? Prevent infection.
I think it's like because it also affects to the body, so we will prevent it from outside first.
Anyone understand?
But so I will think more about it. So you just move on it. Thank you.
Okay, I'm sorry. I'm not clear like about your idea, but like I can, based on your talk, I can understand like you want to say like start with antibiotic first, and then after that you can prevent another infection place, right? And use it's the same. You antibiotics. When you go with the antibiotic, you should go with the IV. Like a pathway, because like this faster and it's more effective, and can have the prevent for the septic. The IV antibiotics, and then we can prevent for the valve damage. By the way, like besides you use antibiotics, you also take care of the valve. For this case, you can go with the like sometimes they recommend do with the valve replacement, or like to like make sure the patient, the heart of the function is still maintained. And sometimes they have like kind of take care about the fever. But if you can use antibiotic, the fever will like gone. It will go, because like that's because of bacteria. And especially here, when you choose the antibiotics, you need to care like that antibiotic can get through to the brain blood barrier. I mean BBB. That's very important, huh? Because like if this cannot go, they cannot treat. So for this case, yeah, they go with the emergency mitral valve replacement surgery to prevent for further stroke and myocardial aneurysm. In here, and myocardial aneurysm, like I can show you guys about that complication, and that's the most common cause. Most common complication usually happen for this case. There's a myocardial aneurysm, and like we start with the ceftriaxone and vancomycin, and they go with the IV pathway, I mean intravenous, and after that the patient recover from neurological deficit and fever stop, and we go with two-way. For this case, in reality, they go like that. So why we go with the ceftriaxone and this the vancomycin? For ceftriaxone, we got usually that's the predominant for the gram negative, and that can get through the blood-brain barrier. For vancomycin, the same, but that's for the positive bacterial. All right, that's a positive and that's negative. So that's the one. That's in the start to use both. Cover too, positive and negative bacteria, because they didn't know what specific organism. So after that they see like Staphylococcus aureus. Maybe they will change, maybe they keep that, because vancomycin still work with the Staphylococcus aureus, but kind of nowadays they have a lot of like MMS or some kind of like this resistant now, so they will replace with another antibiotic. But for me, like vancomycin like still work. Vancomycin you against the MRSA. Yep, MRSA Staphylococcus aureus. This means like methicillin resistant Staphylococcus aureus, and vancomycin can cover this. So that's work for this case. So go with the valve replacement. And I heard interesting story when you guys go with the room, check the medical history, and in that room, like Dũng and Mr. Ang asked about like what the valve you want to replace. I mean like what the like kind of the material, and they can recommend like prosthetic valve or even like about biological valve. Biological valve, this is more expensive, and that's easy get like allograft. It means like organ rejection. But that's a no, it's not like organ rejection, but sorry, that's usually taken from our body. But that's not. Thank you so much, Leon. Yeah, I don't see anyone with smart today. Really? No, we wear the mask and we go to the hospital because of COVID-19, and especially when we continue to the patient who have the high risk with the meningitis, we need to do isolation, especially the mask can help us a lot, especially for the eye too. You can wear the eyeglasses. So where I stop? What? Not related. All right, you guys. So any question for me? Oh, I think this is a lot. I don't know, but I have lots of things to talk about this. I hope it's not overload for everyone. If it's overload, just stop me and say, okay, this I don't need that. Just say another thing. I'm happy with that because I don't know that you guys need that or not, but I feel like I need to share about this because it's important for me. So I think it's important for you guys to, or even like, huh?
Just saying good job, and hopefully everyone learned something.
So that's it. Is that the case interesting, or that's the case like this is too difficult for you guys? I see it's different from like Mr. Leon present a case, huh?
Yeah, neuro is always hard. So.
Yes, a lot, of course. But I think that's I make it is a more easy to understand. So about kind of symptoms and even like the diagnosis for that. All right, you guys, that's too late to stay here. I take you guys 2 hours. That's a 2 hours for this case. I think that's also a lot for you. So if you don't mind, I wish to take a picture to set that, because like every time when I see you guys, it's always beautiful, and that's really like very delight smile. I love that. So please open the account and I can take another picture. Even I have one picture, but I think it's not beautiful enough. So please open the camera if you don't mind, and be beautiful. Please smile, and yes. Vâng, ông Phương Dũng.
Why then? I hear you call my name.
And Nhật, please. And Ngọc, please. Please.
Where's Dũng?
Dũng.
I want to see Dũng.
Why you wanna see Dũng? Anh Dũng, sorry.
Alright, Nhật and
I've seen Dũng for a while,
so okay, just smile and yes.
Dũng is the only one left.
Yeah. Okay. So thank you so much for joining today, and then see you guys in 2 weeks. So next week.
Enjoy, guys. Have a good weekend.
I don't know why I always present a lot of case. It's a difficult case. I'm sorry.
Thank you for your time.
You only got a short stick.
Alright. How can you say no? Sorry, Yuying, right? Where's Yuying? Okay, you guys. Okay, bye bye. See you guys next week. 2 weeks.